Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
This year's flu season, it's actually the worst in a decade, according to the Centers for Disease Control and Prevention. Influenza, or the flu, is a contagious respiratory illness, that is the airways and the lungs, caused by a virus. And if you get the flu, well, the usual symptoms include fever, chills, cough, aches and pains, sore throat. No fun. And in some cases, you may need to be hospitalized, and every year, influenza causes thousands of deaths in the United States.
This year, the number of people falling ill with the flu is still on the rise, and one alarming statistic is the growing number of young children that are dying from the flu. Joining us on the phone to discuss the flu outbreak is the head of Mayo Clinic's vaccine research group, Dr. Gregory Poland. Welcome back to the program again, Dr. Poland. It's good to be speaking with you.
Thank you. Good to be a part of it.
Even if you are in Florida, and we're a little jealous about that. So it's a bad flu. Sorry.
There's no escaping it. We've got lots of influenza here, too.
Too bad. So it's been a bad flu season so far. Do you expect cases to continue, a lot of cases in the next few weeks?
You know, Tom, that's actually a very good point. In fact, the season will get worse by any measure. So far, we've had 38 children in America die from influenza, most of whom don't get immunized. 2/3 of pregnant women in the U.S. have not yet been immunized against influenza. This is a bad strain that's circulating, H3N2. Every year when we do get this sort of strain, and the last time was 2014, 2015, we have relatively lower vaccine effectiveness against that one strain, many hospitalizations, complications, and deaths.
Now, Dr. Poland, I just had heard that there is actually, on social media, there is a fake news story that is saying that the vaccine is completely ineffective this year.
Yeah, you labeled it right as a fake news story. One of the big myths is, the media will proclaim, well, the vaccine's only 30% effective. And it's such a piece of misinformation, and it does such harm to people. What they're saying is that against one of the 4 strains that's in the vaccine, only 1 out of 3 will be prevented from getting any illness. The number who will be protected from complications, hospitalization, or death is much higher. They don't tell you that. The other point is there are 3 other strains contained in the vaccine, and the vaccine is well matched against those. For example, and this will happen through the flu season, which will last another 12 or 13 weeks, is we will begin to see influenza B in particular and some H1N1 cases. In Texas right now, almost 10-12% of the hospitalizations are from influenza B. And the B virus that's circulating is well matched with the B virus that's in the vaccine. So it's important for people to be discerning when they hear that and to protect their own health and the health of their families by getting the vaccine to reduce the chance of complications from influenza A and prevent infection with the other viruses that are also circulating.
So not too late to get the flu vaccine, and how long does it take for you to be protected?
Not too late at all. In fact, I would urge, as I'm sure all my fellow physicians at Mayo Clinic would, is get your influenza vaccine. It takes about 2 weeks before you have, the peak of protection, but it's not too late to get it. As I say, we are very likely to have another 12, 13, 14 weeks of bad influenza.
My pet peeves when it comes to the flu vaccine are 2. First, that the flu vaccine gives you the flu, which I know is not true.
Yeah.
And the second...
I hear that one a lot, Tracy. And, again, that's just real misinformation. The flu vaccines that are administered in the U.S. are all inactivated. We're not using the live attenuated nasal spray vaccine this year because it proved to be ineffective for other reasons. So the only vaccines being given are inactivated virus influenza viruses and pieces of those viruses. It cannot give you the flu. I think what people misunderstand is one of two things. When you get the flu vaccine, it is meant to fool your body into thinking that you have influenza, and so you have immune responses that might mimic some of that. And the second thing is coincidence. We've done, myself, my own group, have published studies showing that whether we give people a flu shot or a saltwater shot, because of the number of respiratory illnesses circulating in the wintertime, that it is coincidence and they have no difference in the symptoms, whether you got a saltwater shot or a flu vaccine.
The other thing that I don't understand is, well, people don't understand what the flu is. If you've got diarrhea or upset stomach, that's not the flu, but it's called stomach flu.
You're exactly right. In fact, most of what's circulating in a given year is not influenza. For example, of those people sick enough to go to the doctor, only about 25% of those with flu-like symptoms actually have influenza. So the majority have adenovirus or other viral or bacterial infections. The ones that cause predominantly gastrointestinal manifestations are not respiratory viruses at all. And yet everybody lumps it into, quote, the flu. So obviously, if we give a flu vaccine and they get a gastrointestinal virus, they say to themselves, well, I got the vaccine, but I got the flu anyway.
All right, Dr. Poland, a little over a minute remaining. I've got 4 quick myth or matter of facts. If I've got the flu, I can infect someone standing 6 feet away.
Absolutely. If you're coughing and sneezing or touching anything they touch, almost a given.
You can only get the flu once per season. Is that a myth or a fact?
That is a myth. That's wrong. Because there's so many influenza viruses circulating, you can get infected and reinfected within the same season. That's why the vaccine has 4 strains in it.
All right, next one. Once I get the flu shot, I'm only protected for a short time, so I'll wait until later in the season.
Oh, it's such a wrong perception, particularly people who have underlying medical illnesses, are very young or elderly. It will last most all of the season unless you have an abnormal immune system. So you want to get that flu vaccine as early in the season as possible to be protected.
All right, last one. Influenza is the only vaccine I need to protect myself from respiratory illnesses in the winter.
Yeah, that's a real myth. Particularly older people or people who have underlying medical problems, there are a number of vaccines that should be given, including pneumococcal vaccine and pertussis vaccine. Every adult needs a one-time dose of acellular pertussis vaccine as an adult, and every adult with underlying medical problems or over the age of 65 needs a series of 2 vaccines to prevent pneumococcal or bacterial pneumonia, which, by the way, is the most common complication after influenza.
Dr. Poland, you have already been on our program once this flu season, and we don't mind having you on 2 or 3 times, but you asked to come back again. And is that last reason that you gave the reason why you wanted to join us again to talk about the flu?
Well, that's part of it. But, honestly, to tell you what motivated that is all of us as healthcare providers at Mayo Clinic carry a motto around, and that's simple 7 words. The needs of the patient come first. And even when information might be unpopular, like, get your flu shot, I feel duty-bound as a Mayo physician to say to our patients and to those who aren't our patients but our listeners, protect your health, protect the health of your family, and even of other families that you come in contact with by adhering to the most important medical advice we can give you this season, which is to get immunized against influenza if you haven't gotten acellular pertussis and if you need pneumococcal vaccines.
Dr. Greg Poland, so great of you to join us. Thank you so much.
My pleasure.
Dr. Greg Poland, Director of Mayo Clinic's Vaccine Research Group, joining us from Jacksonville, Florida. Thanks a lot, Greg.
My pleasure.